I'm your host, Jim Phillips, and my first guest this week has really been in our area only a short time. I should correct that a bit. She spent a lot of time in this area when she was a bit younger. But now Cheryl Bartlett has returned. She has a big job overseeing the operation of the New Bedford Community Health Center. She is the new CEO. Welcome, Ms. Bartlett.
Thank you.
When did you arrive? I think it was June, I saw the first article. You had come back to New Bedford here. This is not your first time through the city, though, is it?
No, it isn't. I spent my childhood, actually through my teens, here every summer with my cousin, my aunt and uncle. My mom and dad shipped me off for the summer.
And you had an uncle who was a police officer in town, right?
I did. He spent his whole career and was in the North End station and then ended his career downtown.
The health center, Community Health Center, is really a remarkable place. For those who don't know a lot about it, it provides health care services to people of low income and the working poor. Did you have a lot of experience running urban health centers in your background?
I actually didn't, but I ran a community hospital, and so I had a lot of experience in healthcare administration. I'm also a nurse by training, so I did a lot of bedside nursing. And at the Department of Public Health, as the director of the Bureau of Community Health and Prevention, and eventually as commissioner, we have a strong relationship with community health centers. I always like to say they're kind of the boots on the ground for public health, really trying to improve the health status of some of our most vulnerable citizens.
Give us some specifics on your background and where have you worked?
So I started out as a nurse. I trained at Yale New Haven Hospital, and my first job was in cardiac intensive care, and actually thought I'd probably spend my whole career doing that. I really like the action. I'm a bit of an action junkie. But somebody invited me to spend the summer on Nantucket at the Nantucket Cottage Hospital. They hire summer nurses because the population grows so much for 3 months. So I went to be summer nurse there and got sand in my shoes and stayed there for 30 years. And 30 years later, when Governor Patrick got elected, a friend of mine became the Commissioner of Public Health for the Commonwealth and invited me to be the Chronic Disease Director for the state of Massachusetts. And I was there 7 years and got 4 promotions and left there as Commissioner of Public Health, the first nurse to actually hold that position. Quite an honor and quite a great experience.
And now you're here.
I am.
In New Bedford. So let us be the first to say welcome, and I'm sure not the first, but let us add our name to the folks who want to welcome you here. You already have some events planned, including a health fair that's coming up. Tell us about that.
So next week is National Community Health Center Week, and it's an opportunity for health centers to showcase the work that they do and the value that they bring to a community. So we're actually kicking it off on Monday. Just confirmed this yesterday with Congressman Keating and Representative Antonio Cabral, several city councilors, to just let people know how valuable community health centers are and to hear a little bit from our elected officials, the conversations that are happening on a state and national level. And then Wednesday we'll have Employee Appreciation Day for the people that work there and are so dedicated to give quality care to our residents. And then Thursday, a health fair where we'll have about 10 different, or 12 actually, I think was our last count, tables and booths to show people the services that are available at the health center, as well as some of our key community-based organizations that we partner with will be there so people can learn where they can get different services.
And people can walk in off the street?
Absolutely.
When and where?
It's on Thursday, and I believe it's from 1 to 4, and it's in the back on the Acushnet Avenue side of our building in the parking lot and maybe spilling into the street. We'll have some fun things for kids to do, some arts and crafts. I think we'll have one of your DJs there having us hip-hopping around in the parking lot with hula hoops, and there's some kind of a jumping machine that the kids love to jump up and down in, so there'll be fun and really important health information.
What is the importance of a community health center in your view? I think in New Bedford here, it's vitally important for the people who go there. How do you view the job that you have?
First of all, I'm completely honored to have this job, and I feel like all the different parts of my career have come together in one place where I can use all the skills and experiences and contacts that I've developed over the years to help continue to serve the population and hopefully serve more people, because we don't only serve low-income people, we serve people of all means. And the better we have a case mix of people with commercial insurance and people with public insurance, the better sustainability for our budget. So we welcome all of you to come and get good care there. But community health centers really have been the backbone of care for people who were uninsured. And as a country, we've had in some states, 40% of people without insurance. We're very fortunate in Massachusetts that now, because we were the leaders in healthcare reform, 98% of adults have some form of health insurance. But in the days when we didn't, the Department of Public Health actually funded community health centers to be able to give access to people who didn't have the ability to pay for care. So really critical component, and I really believe healthcare is a right for every citizen in our country, and glad to be in a state that believes that and funds it. About 25% of people in New Bedford get their care at the Greater New Bedford Community Health Center.
And the truth is, if the health center wasn't there, for some, there would be no health care. They might skip it or might say, well, I'm not that bad. I can avoid going to the emergency room or whatever.
Yeah, I would also say that one other feature of community health centers that's critical is that we're very keyed into the communities that we serve, their culture, their language. We have people that speak 2 and 3 languages. We understand how they perceive the healthcare system and what some of their fears and barriers and challenges are. And we try to remove those barriers so that people will get care, get it early, get their diseases treated early, because we know that's what will keep them most healthy.
You're listening to Townsquare Sunday. My guest is Cheryl Bartlett, the new CEO of the New Bedford Community Health Center. Let's move away from New Bedford just a bit right now with all the goings-on in Washington and the budget debate about to begin, at least in October. Are you concerned about future funding for programs at the center? Is this something you think about? I know that funding for any nonprofit is always that's near the top of the list.
Yes.
Priorities.
It's actually pretty scary for us at community health centers, because about 2/3 of our patients are on Mass Health, which is Medicaid, and Medicaid is really under siege, I think, by the discussions that are going on in Washington. And so we're really hopeful that we can have enough support to keep this program going as it is, because a lot of essential services will be lost. A lot of people will get sick. We'll be going back to emergency rooms, burdening community hospitals that are also burdened by some of the same concerns that we are. So our health system is really at risk, I think, of having some sort of a collapse, which is frightening.
In the past, the health centers have been supported by D's and R's. There's been bipartisan support. Are you concerned that that may crumble a bit?
Actually, despite the conversations about Medicaid, in general, I feel that community health centers are in a good place with both sides of the aisle. In the repeal and replace bill that was presented in Congress, actually community health centers still had a pretty strong and prominent place. That doesn't mean that if they dismantle Medicaid the way it is, it's kind of interrelated. So being strong and supportive of them in language, but not giving the money to actually pay for the care is kind of a contradiction.
What about new programs at the center? I mean, I know that there are always new things happening there, new initiatives perhaps, but with this funding situation where we're all really kind of in the dark about right now, are there some new things happening, new things being planned? Before you came, they made a big addition to the building, and did a lot of work to expand that place, and luckily they got it done when they did, because I think it would really be uncertain if you tried to do something like that today. But what about new programs? Is something you look at?
Oh, absolutely. I have some passions in healthcare. One of mine has been around this whole opioid use disorder and substance use in general, that I've been sort of beating a drum that hasn't been heard too much over the last 20 years. And unfortunately, with all the overdose deaths, finally it reached, I think, such a crescendo we had to do something. And I'm proud to say I was the first commissioner in the nation to declare this was a public health emergency and put significant resources to it. And I'm delighted that the new administration and Governor Baker really has this as a strong priority. So we're looking at how we can strengthen our work around recognizing people that have addiction disorders by screening people more, and we actually just applied for a grant that we're hopeful to get to expand our behavioral health services. So really trying to identify people with mental health and substance use disorders earlier so that we can get them into treatment and care. I also have been looking at joining up with the NAACP from the New Bedford chapter to focus on prostate cancer. There's been a lot of confusion around that with some federal guidelines that dissuaded men from continuing to get PSA screenings, and we're seeing an increase in that diagnosis and mortality from that. So I want to raise some awareness in that particular arena, and always looking to see where there's a gap in care or a need that isn't being met so that we can find ways to get it. And I'm persistent no matter what. If there's no money from the feds, I'll squeeze it out of somebody.
Is staffing an issue in health centers like this one? In urban health centers where there's always some financial thing handing over, overhead, I would imagine the staffing can be an issue with people coming and going. Is that an issue here in New Bedford?
Absolutely. Health centers in particular have a struggle to keep really top quality doctors and other clinicians because we can't keep up with the pay scales of the big hospitals. Partners, they're a giant. And so people tend to go where they get better compensated. And people that work at health centers, I think that's what's so special about health centers is people are really there because of the passion and compassion they have to serve people in need. And so a lot of our doctors could be working somewhere else making much bigger salaries. And I'm delighted that there are people like that care about the mission first.
And there's a lot of people there who care about the mission.
Yeah, I think that's what attracted me to the job. I spent about a half a day with them during my interview and just came away feeling very uplifted with the enthusiasm that people had for the work they did.
How is the center primarily funded now? What's is there a percentage of grants and gifts, state funds and federal funds?
Yes, there's a mixture. I would say our primary revenue source is reimbursement for the services that we give, and that's through Medicaid, that's through private insurance companies. Again, we don't get paid quite as well as a hospital does, so that's always of concern. So we make ends meet with federal grants and state grants.
A little more than a year ago, before your time here, there were questions about leadership at the center and the center's financial footing. I know that happened before your time, but you now come in, you're in charge. Can you now say that those issues, whatever they were, are now behind the health center and financially you are where you should be?
Absolutely. And quite honestly, I've heard a little bit of rumblings about that, and I made the decision that the people I met didn't give me any indication to be worried about what was happening at the health center. And now that I'm there and can see with my very own eyes that they have a really top executive management team, we have program managers that are really strong and have been there for decades and really care about their work. So I feel very good about the position of the health center.
One more time on the information for the health fair. It's coming up on Thursday. That is a week or so, actually less than a week.
The 17th?
As the show airs. 17th, thank you. That's the 17th. Give me the time and the place again.
1 to 4 p.m. It is in the back of the Community Health Center on Acushnet Avenue, and we'll have lots of fun and good information for people to take away with them.
And a good way for you to meet some folks, too.
Absolutely.
Yeah.
I love being out in the community.
Glad to be back in New Bedford?
Absolutely. It's a wonderful port. I love the commercial fishing and the waterfront and restaurants. Reminds me a little bit of my life on Nantucket in terms of the cobblestone historic nature of it, and see the great potential it has to attract a lot of people to visit.
Had a chance to visit a lot?
Yes.
Visit places?
I try once a week. I try a new restaurant. I came the week before I started and went to the Whaling Museum, kind of dusting off my cobwebs from years as a kid here in New Bedford, and really pleased to see at the preservation or the renovation of a lot of the historic buildings so that you can attract business, and business brings money, and money helps everybody
Absolutely.
Improve their health.
Go to Fort Tabor, Fort Rodman.
Okay.
Take a view of Buzzards Bay.
Ah.
It'll take your breath away. My guest has been Cheryl Bartlett, the new Chief Executive Officer for the New Bedford Community Health Center on Purchase Street downtown. The health center is an important entity in New Bedford, so we certainly wish you well here.
Thank you. Thanks for having me.
Thanks for coming in. Townsquare Sunday will return in just a moment.